let me first start off by thanking all of our district managers and staff who are on our Zoom today. Today, we are pleased to be joined by Legal Services for Elder Justice and Visiting Nurse Services of New York. So let's jump into our presentations. I would like to welcome Donna Doherty and Diane Woodburn from JASA Legal Services for Elder Justice. Donna is the attorney in charge of legal services for Elder Justice and will discuss the services provided by JASA and using technology and the technology they use to reach seniors, including risk detectors. Diane Woodburn is a legal services supervisor and will discuss the Protect Our Home initiative that the New York State Office of the Attorney General launched, which protects homeowners from deed theft scams through community education and outreach, enforcement, and policy and legislative proposals. Ms. Woodburn will also discuss elder abuse and foreclosure prevention. I want to welcome both Donna and Diane. And Donna, I guess you're going to kick this off. Good morning, everyone.
Good morning. Good morning, Borough President. Good morning, everyone. And yes, thank you for letting us have this opportunity this morning to speak to you about our program and get the word out. JASA, Legal Services for Elder Justice, is a civil legal service program providing direct representation to people 60 years and older throughout Queens. I'm going to share my screen and hopefully we have a small presentation here. And can everyone see that? We're good. As I said.
Yes, you're good.
Good, thank you. I just want to remind everyone about this great borough we are in and the people we serve. As everyone knows, we're the world's borough. We're the most diverse county in the US, which is amazing. With people over the age of 60, that makes up 19% of the Queens population at last census. 31% of these people are living at or below the poverty line, which means they're at the federal poverty line, 25,520 for a single person living in Queens County in the New York City. More than 50% of our clients prefer a language other than English, which I think is pretty consistent across New York City. Over 20% live alone, and 22.6% report having some sort of self-care or mobility issues. So this is an extremely diverse population, one that's rich, but also a good number of whom have needs. We provide, as I said, civil legal services in the areas you would expect, those that are affecting and placing our seniors at risk. So those include evictions, loss of public benefits such as Medicaid, inadequate health care, elder abuse, and financial exploitation. And this fulfills our mission to keep people in their homes safely and with dignity. These are the services. There are others, but basically most of the people who come to us either have a tenant issue, they're in foreclosure or predatory lending. We have a number of individuals, and Diane Woodburn will talk about these, who have lost their homes to real property fraud, entitlements to government benefits, including SNAP, Medicaid, Medicare, health and long-term care. We obviously work with agencies like VNS, who is here today, consumer and utility law, family law, and elder abuse, getting orders of protection so our clients are safe. The risk detector is, and I just want to talk to you for a minute about it. We try to reach out to individuals in all ways we can, and we'll give you our contact info at the end. But one of the ways we do this is through technology, which of course only became more important during COVID. The risk detector is a web-based health checkup tool. So social workers, paralegals, lawyers, we're talking to clients or going out in their homes or going out to a healthcare facility, does a very quick questionnaire with the client. Takes about 5 minutes, not even. That automatically, through an algorithm, sends a risk to my office, and this comes through email, and this is what I get. So every day I'm getting about 30 of these, and our lawyers are, which are saying that an assessment was done, on a senior in the community, and they have, in this case, a very high risk. And then it will tell me what the high risk is in. Is it in housing? Is it in healthcare? Are they being abused? And immediately we're able to contact the social worker on the scene or the client and address the situation immediately. These types of technology and this type of outreach is important, as we know, as Queens is, all the way from the Rockaways all the way to the bridges. Dion's also going to talk about some special programs, as the borough president said, that we want to get the word out. And it's so important that you have this information for your constituents. So I'm going to turn it over to Dion.
Good morning again. So during the pandemic, we saw a rise in scams which were targeting the Queens community and especially our senior population. We had COVID scams that they're almost too numerous to detail, but we can always present on them at another time. We had scammers who were pretending to be from the CDC, offering fake vaccines. We had scammers pretending to be from mortgage companies. And what they were trying to do was steal information, asking for pertinent things like your social security number, your bank account and routing numbers. We even had a senior apply for a fake job through not Indeed, but something like Indeal. Realizing that many people were falling victim to scams and that our seniors were especially targeted, we teamed up with the Attorney General's office and CNYCN and to do the Protect Our Homes initiative. And with the Protect Our Homes initiative, as mentioned, the focus is prevention and enforcement. And we're providing critical outreach and education to homeowners at risk of being displaced through their communities. In Queens here, we actually formed a Queens Coalition, which includes Legal Aid, Brooklyn Corp A, Neighborhood Housing Services of Jamaica, and of course, JASA-LSEJ. So we talk about prevention and we back it up with enforcement. But besides law enforcement agencies, we at LSEJ have other types of enforcement. That's legal representation that we do. What if you've fallen victim to a scam or you're in foreclosure? We have a foreclosure and scam prevention division. With foreclosure, as we know, the moratorium is until January 15, 2022. So foreclosures haven't necessarily been on the rise, but as soon as the moratorium is lifted, we know that we're going to see more and more foreclosures. So while there is the moratorium, there are services that can help people who are in foreclosure. For example, you have ERAP, the Emergency Rental Assistance Program, which provides significant economic relief to low and moderate income households who are at risk, of course, of homelessness or housing instability. And they provide temporary assistance through rental to pay your rental arrears or utility arrears. There's also LRAP, which is the New York State Landlord Rental Assistance Program, again, providing rental assistance, but this time to landlords who may have been stuck with an apartment that's now vacant because the tenant has left, or their tenant refuses to apply for ERAP. We also have HAF, which we've heard a lot about, but it still isn't quite out yet, which is a homeowner assistance fund, which would help those who are behind or delinquent on their mortgages. Those people who are experiencing financial hardship after January 21st, 2020. So let me tell you a little bit about some of our clients that we help, and I'll use one client in particular, that's Miss Smith. Miss Smith is a 73-year-old Haitian immigrant, and she's been here for over 45 years. Her native language is French Creole. She understands English well, but she has difficulty reading English. So in 2000, Miss Smith and her daughter purchased a two-family home. Miss S paid most of the down payment. And after purchase, Miss S made more than one half of the mortgage payments monthly. She also paid most of the carrying costs. A few years ago, however, she was forced to retire because she had hurt herself on her job. So because of this, her contribution was going to decrease. She let her daughter and her granddaughter know, but they weren't happy with this. And they said that she had to pay more. She couldn't. So her daughter and granddaughter came to her and said, look, let's refinance the home. And then this way our payments may be reduced. Miss S thought it was a great idea. Her daughter brought her documents to sign. She signed it, of course. They were all in English. She didn't read it, and she trusted her daughter. What she didn't realize that was what her daughter and granddaughter brought her to sign was actually a deed. And it was a deed transferring the ownership of her home from herself and her daughter to now just her daughter and her granddaughter. As soon as they filed this deed, they started to make it unbearable for Miss S to live in the home. In the summertime, they would remove the AC. They relegated her to a small portion of the home, wouldn't even let her go into the backyard. And when that didn't work in getting her to leave, they started eviction proceedings against her. That seemed to be taking too long. So then they started to threaten to physically harm her. They told her they were going to hurt her. So finally, Miss S, with no other choice, went to the police. And the police referred her to JASA-LSEJ program, which is a multidisciplinary program which combines social workers with the JASA-LSEJ attorneys. It's more of a holistic approach to protecting our clients. Through this program, we obtain a full stay-away order of protection for Miss S. We stopped the eviction, and we brought a quiet title action in the Supreme Court in order that Miss S would recover the interest in her home. These are just some of the services that we provide, and just one of our clients. Donna will tell you how you can contact us for if you need further assistance.
So yes, the important thing is, as these demonstrate, we want to get people at the earliest point when they're having an issue. And no small problem is too small. So we have a variety of ways. There's our general number, which is a 286-1500. It's answered every day. Information will be taken, and we have an intake attorney that speaks to people who call up. We also have the JASA helpline, which again is an email, and there's a JASA helpline number in case you're not sure exactly what your client needs or what your constituent needs. It may not be just legal, maybe they need other social services. So that's the general JASA number. They will then get you in touch with the appropriate JASA services, including legal services for elder justice. 311 has been amazing. They have referred many individuals. People call up saying, I'm being evicted, I'm being foreclosed, I'm being abused, and it gets to us the same day. The homeownerhelpnewyork.org is for the Protect Your Home program in particular. So that's for the homeowners in Queens. And then, of course, our emails are there, and feel free to reach out if you have just a question or want to refer someone. And then we also gave you JASA.org, which is the JASA website where you can find general information about all of the JASA services. And again, we want to thank you for your time this morning. And if you have any questions, we certainly can stay around and answer. But we are grateful for your partnership and for the borough president's support. Thank you.
Thank you so much. A great presentation. So I know you've been doing some great work around this. Sort of want to know, you know, with the pandemic playing out, and obviously the eviction moratorium will get lifted eventually. You know, what things are you doing? How are you thinking creatively about doing outreach to, you know, seniors especially who are vulnerable around foreclosures? And then obviously I'm very happy you touched on deed theft, because that has been, I mean, I've been getting calls on that for a while now, and we need to do a lot more education, and which you are obviously on this issue, but how can we be helpful to spreading the word about your services more? And how can the community boards work with you closer on this issue?
I'll let Dion speak about the foreclosures. Yes, I think we're all are very concerned about January 15th and what it'll mean for many individuals struggling, including seniors. We have been working with the courts to make sure that they refer as soon as the court has a case that involves a senior, that they immediately have been emailing us. And they have been doing that even for those that are on hold right now. And we have been helping people. Obviously, we helped people do the hardship declarations, both in foreclosure and in landlord-tenant court. But I think one of the ways that we'd like to work, and we have been working with the borough president and the borough board, is if there's presentations we can give in the community, if you want us to come out, and it's all about getting the word out. I think people don't know, they know they're in trouble, but they don't know who to reach out to or how to reach us necessarily. So that's important. That's why Dion was working. We've been doing in foreclosure, maybe you can talk about that for a minute, Dion, presentations through webinars, through other means to get the word out about things like the homeowner program and homeowner assistance fund. Dion?
Yes, so we've done quite a few presentations. We actually hold town hall meetings once a month, the Queens Coalition. We also have been doing there's been some outside tabling because of the pandemic. We haven't really done too much indoors. We've been doing a lot of virtual presentations, even to the senior centers. We'll do the virtual presentations there as well. As Donna said, what we're trying to do is just get the word out. We've had several assemblymen and assembly people, as well as council members who have been, who've helped us to do the presentation. In fact, we have one coming up on November 17th with the NAACP. And so we're trying to just get the word out as much as we can in whatever ways we can. There are some organizations from our coalition who are actually doing door knocking, and we have a lot of flyers out. There are also door hangers for the that go on the people's doorknobs. We're just doing whatever we can to spread the word.
And you said you have a fund. So that's relatively homeowners could tap into that fund if they're behind on their mortgage, or how does that work? I thought you mentioned the fund.
Yeah, homeowners assistance fund. We're not exactly sure when that's going to start, okay. And that is going to be for homeowners who are behind on their mortgages. But we are one of the organizations that will be helping to people to do the applications for that fund.
Got it.
You probably know that's part of the money that came down from the federal government. It just has not gotten up and running. It was the mirror to ERAP, the emergency rental assistance, but it has not, they haven't opened the portal. And so homeowners have been waiting, but we are hoping that it will be open soon, obviously. And we're, yes, one of the organizations that are going to be helping with those applications. And I will say the borough president and the borough board, I mean, you have a great following. So people will come out to things that you present. So to the extent we can get the word out with you, we're here to help.
Yeah, and I think for the staff, we could think about doing like a virtual town hall, especially leading up to eviction moratorium. So perhaps December, as soon as this fund opens up, and we can check in on where they're at with that. Okay, righty. I have questions from Florence. Following Florence will be Mark McMillan. Unmute yourself.
Good morning. Yes,
Good
sir.
morning.
Good morning, Mr. Borough President. Thank you for having us today. So I put in the chat, Donna, I came in a wee bit late. Our board is having our full board meeting on the 16th of November. If we could get a rep, I'm doing my agenda today. I greatly appreciate a contact. The information that you put up with the phone numbers and contact information, can you please be assured to email that all of our offices? We would greatly appreciate your contact information. So
Yes.
you actually answered my question with the fund. The Borough President did ask a question I was going to ask. I would appreciate a follow-up at my office.
Yes, we will do that.
Thank you.
Thank you.
Thank you. Mr. McMillan.
Good morning, Borough President, fellow DMs. Really good presentation. I just wanted the contact information also, so I could reach out to you directly and be able to bring that information to my constituency. So thank you very much.
That would be great. We will get it
And
out to you.
and Donna, I don't know if Donna or Diane can answer this. I had worked on with my colleagues specifically in Southeast Queens, Danique Miller and Adrian Adams. We had done a lot of work in the council around the foreclosure assistance program, I think. So y'all tapping into that? Are y'all in that? Or, I mean, if you're not, we should talk offline so I could work to make sure, you know, that initiative continues. I'm sure it continued, but I want to make sure your organization is actually a part of that on the foreclosure piece.
Yes, I think what you're talking about is with the HOP program, and
You
yes,
have the foreclosure prevention program.
Yes.
Right.
Yes,
Okay,
we
so
have.
y'all
Yes,
are tapping
we're
into that.
definitely a part of that. I
Okay,
also
good.
just wanted to mention quickly that what's coming up is the tax lien sale.
Yep.
So we've been doing a lot of presentations on that as well, because that is scheduled for December 17th. So we're trying to let people know about it and to do the hardship declarations if they qualify.
Well, we're trying to get that canceled, but we'll see what happens.
I agree. I would love for it to be canceled.
I agree.
Being canceled during this pandemic, especially. All righty. Well, thank you. Oh, Ivana, you have a question?
Yes, I do.
Go ahead, and you unmuted today with no problem. I'm loving it.
Good morning, Mr. President. Good morning,
morning.
everyone. In Community Board 12, we have the highest rate of foreclosure. And I know we've been working extremely hard, but we continue to have that high rate. And I know I work closely with NHS and always talking about foreclosure because it's something that's continued. It's not decreasing, but in some cases, years, I think it have increased. So I certainly would like to have all the information that you have, and also the foreclosure lien. Hopefully that will be helpful.
Yes, we'll provide the information.
Yes,
Thank
and we
you.
know
My staff could send
about
it
your
around too,
area.
if we have it, if we should just send it to all of the boards. So everybody has their contact information.
Thank you.
All right, thank you. All right, we're gonna go to our last presentation now. For our second presentation today, we're joined by Andrew Plisner. Did I say that right? Hope so. From the Visiting Nurses of New York. For over 125 years, the Visiting Nurses of New York has been providing essential home health care needs to New Yorkers. It's one of the largest non-for-profit home and community-based healthcare organizations. VNSNY serves the 5 boroughs of New York City and beyond, offering a wide range of services, programs, and health plans to meet the diverse needs of New Yorkers. Andrew is the program manager of the Queens Children's Mobile Crisis Team. He spent the last 4 years serving the Bronx with CMCT and VNSNY's school-based Promise Zone program. His current capacity managing the overall operations of the CMCT program. Andrew will outline Visiting Nurses of New York's Children Mobile Crisis Team Services model and how best to utilize our supports. The presentation also aims to strengthen relationships across the borough neighborhood districts in order to be of greater service to the community. So I want to welcome you, Andrew, to give your presentation.
Thank you so much, Mr. Richards, and everybody for the invitation to be here. Khalil, thank you so much for your communication and supporting with this. It's been so helpful. Again, I'm the program manager for the Queens Children's Mobile Crisis Team with Visiting Nurse Services of New York. I will go ahead and share my screen briefly, slideshow. Oh boy. I apologize, I'm not the most technologically literate person. Okay. Is everybody able to see this?
Yes, sir.
All right, great. Thank you. Thank you. So the Children's Mobile Crisis Program is, oh boy. Got it. We're a Department of Health and Mental Hygiene program. We've been partnered with the city for, I would say about 30 years, and that partnership has grown more and more. We're a grant-funded program. We serve, in terms of our Children's Mobile Crisis Team programs, the Bronx, Brooklyn, and Queens. The Bronx is our oldest program. They started in 1989, and that predated the city partnership and then expanded to Brooklyn, and then Queens is the most recent borough that we've been providing our services in. Again, we're grant funded, so all of the services that we provide are free and available to the families that we serve. We've recently begun accepting insurance, and naturally, you know, with changes at the state level in terms of how services are being coordinated, documented, tracked, and so forth. They're looking to see how that can be more strongly integrated into the services that we deliver. However, there is never a family or an individual that is denied access to our service. If folks are uninsured, we help them get connected to insurance, and any other barriers that may be interfering with access to services, which I'll get into later in the advocacy piece, we work to resolve and support. So we provide voluntary rapid response crisis care for children, adolescents, young adults, and the families in need. A rapid response means that we arrive within 2 hours of receiving the referral for the individual. All of our referrals are filtered through NYC-Well. NYC-Well sends those referrals to us. As soon as you receive the referral, we arrive within 2 hours at the location of the crisis. Families in need of our services oftentimes are needing support with crisis assessment, crisis stabilization, prevention planning, linkage to additional services, caregiver support. And again, in terms of the demographic, we serve ages birth to 20 up until their 21st birthday. Moving on to our next slide, in terms of our operations, we operate from 8 a.m. to 8 p.m. Monday through Sunday, providing rapid response and crisis management services for children, adolescents, and young adults experiencing crisis situations. Crisis stabilization services are provided outside of these hours. So any sort of triaging that's needed between the hours of 8 p.m. and 8 a.m. is offered, typically through NYC-Well. And if we have anybody, any staff that's on call, usually a manager, to be able to triage, we'll do our best to do that. However, we won't be responding to the crisis until the next morning at 8 a.m. When our hours of operation begin. As I shared, we serve all borough, school, and community districts in Queens. We don't have any specific catchment area. We travel to all corners, all areas of the borough. Again, in terms of submitting referrals, NYC-Well crisis counselors are available for support with referrals for anybody who's looking to make a referral for an individual in crisis, and can be reached directly at the number below, 1-888 NYC-Well. 692-9355 is the numeric entry. As far as the timeline of services or the coordination of services, an initial contact will be made with NYC-Well by telephone, and a rapid response is going to be conducted at the location of the crisis, typically in the school or in the home. Again, our services are voluntary, so as soon as you receive the referral, we'll reach out to the parent or the guardian of the individual that we've received the referral for, explain a bit about our services, the reason we've received the referral, and make sure they're interested in receiving our services. When the family accepts services, a team consisting of a psychiatric social worker and a family advocate, again, is going to respond to the location of the crisis within 2 hours of receiving that crisis referral. During the school year, many times our referrals are coming from schools naturally. We receive a lot of self-referrals from families. And there are times where families decline services. That's okay. We always encourage them, if at any time they are interested in services, to call back and send another referral through NYC-Well, and supporting them with what that process looks like. Cases that are taken under our care and that are provided services are offered crisis de-escalation and risk determinations, psychosocial assessments, any initiation of prevention planning, of course, collateral collaboration with existing services, linkage to ongoing services. We provide coaching and psychoeducation for caregivers on how to manage any future crisis situations, and also how to prevent and look out for any sort of warning signs of crisis escalation. And our service duration is up to 4 weeks for the amount of time that families can anticipate receiving our services. So when a crisis call should be made, really anytime. If there is any concern or any observation of changing behaviors, you know, of wellness, of safety, please feel free and call us. We have very few restrictions in terms of referrals that we accept and referrals that we're unable to accept. Really, the only referrals we're unable to accept are for clients who are 21 and over, and those will redirect to adult mobile crisis teams. Some examples of what to look out for and when making a crisis call include an individual who may be behaving in a threatening manner. That could be, you know, verbally, that could be physically. There could be extreme acting out behavior, an escalation in disruptive behaviors. And again, that can be in school, that can be in the home, that can be at a clinic, that can be at a doctor's office. It doesn't have to be limited to a specific, you know, again, environment. Again, another example is if an individual is experiencing a psychiatric crisis, so that can be uncharacteristic behaviors, possibly disorganized thinking, extreme mood fluctuations, if there's non-compliance with current mental health services or refusal to seek mental health services, ongoing truancy with school. Again, these are just some examples, and any other crisis that may be falling under there. Similarly, if an individual is displaying symptoms of mood dysregulation, so, you know, experiencing some withdrawal, any loss of appetite, passive suicidal statements, signs of self-harm, reports of wanting to self-harm, a victim or a perpetrator reported bullying. And again, these are all just examples, not in any way exclusive to referrals that you may submit to a mobile crisis team. As far as who should make a call, anybody and everybody is welcome to make a call. One of our boroughs received a call from a 15-year-old last week who was really needing support, and we of course had to call the guardian in order to get the guardian's consent to provide services. So the referrals are not limited to any specific individual. For an 18, 19, 20-year-old who is needing to consent to those services, they can make that call directly. Schools, again, are definitely a heavy referral source for us. That can be any school, public, charter, private, day treatment, intensive day treatment, any sort of school. Service providers, that can be outpatient, that can be care management. Hospitals, including psychiatric and medical care providers. So if they're a specialist and the specialist is having concerns, if they're being discharged from a psychiatric observation and you know, the follow-up unit at the hospital is unable to make contact with the family, they can reach out. Agencies such as ACS, preventive services, family courts, juvenile courts, any agency and any community agencies such as, or community institutions such as, you know, again, police departments, fire departments, libraries, anybody who's observing any sort of need for support. Families as well can self-refer. That can be immediate family, extended family, foster family, adoptive family. Again, this is not limited to anybody. Our services are open for all referral sources and for all individuals 20 and younger who the referral source believes may be in need of support and could benefit from our voluntary service. So this is my contact information. I know I breezed through this really quickly, and I'm not used to doing presentations through a PowerPoint. They're typically verbal, so I appreciate your patience as I fumble through these different slides. But I would be delighted to answer questions because I'm quite certain I've missed some information.
You did great. So I guess, Mike, the one question I have is, have you seen an increase in calls during this pandemic? And I know a lot of children, you know, obviously have been impacted by COVID-19 and the impacts on social and emotional awareness or the social and emotional aspect of for our children has definitely been tough. So are you seeing much more of an increase in need or, through this pandemic?
Over the last year, we've really had, as have many providers, I think, had a difficult time being able to connect our services to families in need. I think a bit of that is because much of it was remote. A bit of it is because, folks were not in their offices. It was difficult to broadcast what services we provide and get that out to the community. So as things started to open up, we've definitely seen an increase in referral volume. Typically in August or July, we only have historically maybe 10 or 12 referrals. This year, we're having 40 and 50. Our minimum level of service for admissions per our grant contract is 730 for the year. We do anticipate surpassing that. So we do see absolutely a significant need, an increasing need. And, on our end, one of the great things is there are a lot of service providers who understandably are very thinly stretched right now in services that they're able to open up quickly to families and individuals. I think our program is one of few services that provides an intervention other than perhaps EMS as quickly as we do, within 2 hours. Also, our service, I think, being the rapid response service that it is one of very few services that serves families up to 4 weeks for a service duration. So it's not, a situation where we assess the family, we make sure that they're safe, and then we disengage. We ensure that the child, the individual, is safe at the time of the assessment, permitting they're safe, and an escalation of support isn't needed, such as a psychiatric evaluation at the psychiatric ER. We'll continue working with the family on a weekly basis to not only connect the child or the individual to services, but to see what additional supports can be provided to the full family. And that can be advocacy services, that can be, again, shelter, food, any other sort of hard services, that can be case management, care management services, peer services. We're very creative in terms of how it is we get people connected to the services that they're needing, and very diligent about that as well. And so our primary partners right now are schools. That's who's made, again, the largest volume of referrals to us historically. Our hope is to be able to get connected to you all and your constituents and your community districts, and see how we can build inroads, into your communities and serving the community members that you represent. We want to make our services as again, accessible and available to as many folks as possible. We believe that our service is definitely strong and very much needed, and are just trying to find as much as many ways and as much possibility as possible to again advertise and broadcast the services that we offer.
Thank you, Andrew. Okay, we're going to open it up for questions. Anyone have questions for Andrew? And just, I guess the last question I have, I'm seeing none, is just walk me through. So somebody calls your hotline and then what happens?
So what happens is we receive, so the individual, we can at times receive direct calls from, we at times receive direct calls from referral sources who would like to make a referral. We always direct them to NYC Well. We can't take referrals directly. We'll provide them with NYC Well's phone number. NYC Well will take demographic and presenting stressor information, the reason for the referral and the contact information, demographic and so forth for the individual, where the client is. Once we receive the referral, which is distributed to us through an internal electronic fax system or server, we reach out to the family or to the guardian, screen the referral, make sure that they're interested in services, that they're accepting services. Once they accept services, we will go to the location of the crisis. And again, that's either the school or the home typically. We've had other times where we've conducted assessments in the community. So we really work to meet folks where they're at and not limited to a particular specific location, while ensuring confidentiality. I know there have been library assessments previously, any way that we can make sure we're making contact with the individual. So once we arrive at the location of the crisis, we have a family advocate and a psychiatric social worker who conduct a family assessment and a client assessment. The family advocate who conducts the family assessment will gather some background information from the family, as well as medical information, childhood development information, and the psychiatric social worker conducting the client assessment will conduct a comprehensive assessment of what's going on with the child at that time, or the individual at that time, get to know them, build a relationship, and get a sense of what their perspective is of the crisis. They'll do a safety plan with them, and then after the social worker finishes with the child or the young adult, if they're 17 or younger, so the adolescent, go back, review with the guardian, and again, as long as they're safe at the time of the assessment, they'll start working on linkages to other referrals, or linkages to other services. So typically that's a mental health service, an outpatient service, a home-based service, but again, with providers being so thinly stretched and there being a very long wait list oftentimes for getting families connected to services, we have to get very creative in terms of, what bridges we're building. And so we may get the family connected or individual connected to one short-term service, then another short-term service, and that bridges to a longer-term service. And that's over the course of 4 weeks, making weekly visits and having continuous follow-up with the family, as well as other providers that are supporting the family. So, it's a very comprehensive service and a comprehensive support, which again, I think is what makes our program really unique, and very involved and extensive.
Thank you for that. Okay, any other questions? All right. I want to thank all of our presenters today for attending, all of our district managers as well. Any district managers have questions on any other things or requests for any agencies next month? Okay.
Carrie
Everybody.
from CV5.
Oh, go ahead.
Yes, sorry, Borough President. Thank you for having these two presentations. My concern is what happens if someone is in crisis after 8 p.m.? Because a lot of problems for people occur in the evening or the early morning hours. What does someone do when they're in that kind of a situation?
There are NYCWell counselors available to triage those crises at that time. Our program used to be a 24-hour program. However, due to some different changes at the city and state level, they modified operations from 8 a.m. to 8 p.m. So we similarly used to triage between the hours of, our previous operating hours were 9 to 7. So between 7 p.m. and 9 a.m., we would triage. Now NYCWell triages. They make sure that they safety plan with the family during that time of crisis, recommend an EMS call if the crisis is escalating and uncontrollable, and again, send us a referral. We have a team reach out first thing at 8 a.m. in the morning. Oftentimes the calls that we're receiving are chronic crises. And so, the counselors work to skill build with the strengths that exist within the families and make sure that they have a plan in place for those next 3-4 hours before somebody on our end is able to give them a call.
The other question I have is, I know someone who called NYCWell and could not get anyone on the phone and received a return phone call 2 days later. So what can somebody expect for how quickly NYCWell will take a call and help anyone?
We have NYCWell directors meetings once a month, and we bring concerns that we're hearing from either referral sources from families to the city and letting them know these are the concerns that we're experiencing. I know at NYCWell, just like at many other organizations, they're struggling with staffing, they're struggling with turnover. And I know there's some loose threads that are getting tied up, all around across all of the many organizations that are trying to deliver services to families. So I know that there are going to be times when something slips through inadvertently. We have no control over that. The only thing that we can do is respond when we receive the referral and bring those concerns to our partners.
Yeah, not to interrupt you, but I think there's a lot of talk about mental health services, but how available are they compared to what the need is? And I know, for a fact that a lot of the better psychiatrists do not take insurance, and you can't get a booking. So we as a society have a lot of us who have mental health issues at different times, but I don't know that there are enough people trained to help people, certainly not at a higher level. And a lot of psychiatrists do not take insurance. That's not for you to answer. That's just a statement I make. If anybody wants to refute it, I'd love to hear it, but big talk, little do as far as a lot of psychiatric service availability goes.
No debate on that. Okay. Any other questions, comments, or concerns? All righty. Seeing none, I want to thank all of you for attending. I want to thank Diane and Donna and Andrew. Thank you for being here and providing us with an update on your services. And I urge all of our DMs to take this information back and make sure, especially your residents know, your constituents know about these